Today, we're going to talk about the aging spine. Those of you who have a car or machines at home, you know that over a period of time, the car needs frequent servicing, the wheels have to be aligned, the tires have to be changed, the car has to be oiled well, and it does give wear and tear. The same way with machines at home, like your mixie or wet grinder, it keeps making noise, it have to change the parts, it becomes slow, and then it starts squeaking and then giving problems. The solution to machines and cars is you can change the parts or you can sell and buy a new one, but you can't change your spine. Our spine is made up of bones and ligaments and nerves in between. So as we get older, the bones become weak, the muscles become weak, the joints between the bones also have wear and tear. I want to quote a very interesting Japanese study where they followed up about 200 patients over a 20-year period with an MRI scan. They also gave them questionnaires about their lifestyle, their problems in the neck and their back. The observation of the study was that there was a significant number of patients who had wear and tear of multiple discs both in the neck and in the back on MRI scans. But only 80% of those who had a significant problem actually had symptoms, and only a small number of them required surgery. So not everybody who has a bad wear and tear in the spine always is symptomatic or requires an operation. At the same time, they also found some interesting lifestyle changes which were contributing to worsening of their spine. Those who were smokers, those who were obese, those who had a sedentary lifestyle and who had unhealthy eating habits. So these were the patients who had a much worse spine problem compared to those who did not have problems. So as we get older, our spine does degenerate. We have to learn to accept that gracefully, slow down, enjoy what you can, and accept that your body is getting older. Yes, you will have some neck pain and back pain. If you have a severe stenosis or a compression of the nerves, you will develop pain in the legs or pain in your hands. You may get tingling and numbness. You may have some difficulty in walking, especially you will not be able to walk long distances without stopping. You may have balance problems. So these are all part and parcel of things that happen with age. There are a few things that I want you to remember. Number one, if you have significant pain that is not getting better with pain medication, with rest, then you need to be concerned, because fractures in the spine because of weak bones and osteoporosis is very common. Second, you will notice that your posture is not straight anymore. You may become shorter, you may be bending forwards, and this is again because of weak muscles and also maybe weak bones. So you have to try to correct your posture, because if your posture is not correct, you may develop vertigo, you may develop headaches, you may fall down, and you can have fractures because you're not able to maintain your posture. So what can you do to have a healthy spine when you get older? You have to remember that when you are young, if you're healthy and active, your old age would be pain-free and happy. So what can you do as you age? You cannot stop aging, but there are two things that you can do. One is to prevent any problems from happening, and two is to stay healthy. So what can you do to prevent? You have to increase your bone health by eating calcium, vitamins, exposing yourself to sunlight and staying active. So this improves your bone health, you prevent having osteoporotic fractures, and you do not have pain or problems. Number two, staying active. The more you're active, the more your muscles are strong and more you're able to maintain posture by doing exercises, by doing yoga, Pilates, and so many other things to correct your posture, and that would keep your spine healthy for age.